Alright, today I am going to talk about diarrheal disease in children. Why is diarrheal disease in children important and why should I be talking about it? Diarrheal disease in children is important because every year, the world over, there are more than 1.5 to 2.5 million children that die as a result of diarrheal disease. And this is more common in the developing countries such as ours, where healthcare facilities are not optimal. I have seen a lot of times parents brought their children to the hospital, to the clinic, at a time that nothing could be done. When the children have reached a state of severe dehydration and cardiovascular collapse. Not quite long ago, I had such case, and when the mother brought the child, it was already too late. So this is the reason why every parent, every mother should be aware of diarrheal disease and what they should do when a child has diarrhea. And I want to define what diarrhea is and what it is not, because some parents do not even understand what diarrhea is. Many times parents come to the hospital and try to speak a medical language that they don't even understand. So we will ask them, what do you mean exactly that your child is having this medical condition? So by way of definition, diarrhea is frequent passage of loose or watery stool that deviates from a child's usual pattern. What is diarrhea to one child may not be diarrhea to another child. So every mother should know the bowel habits of their children so that if it deviates from the usual pattern, they can do something about it and prevent the child from getting into severe dehydration. Now, there are mechanisms of diarrheal disease which could be classified as osmotic mechanism, secretory mechanism, inflammatory mechanism, and malabsorption mechanism. Let's look at what the osmotic mechanism is all about. A child may have diarrheal disease if there is the presence of non-absorbable solutes in the gastrointestinal tract. Example of such is lactose. There are people that cannot tolerate lactose, and these are called lactose intolerant people. So people that have lactose intolerance can have diarrheal disease. And if that food substance is taken away, it is removed, the diarrhea will stop. A number of times, what parents do, which I am aware, is that whenever a child has diarrheal disease, instead of going to the hospital, they will go to patent medicine sellers and buy all sort of medications that may not even help the situation. Another mechanism of diarrhea is the secretory mechanism. This can happen when there are toxins. For example, toxins from bacteria. When there are toxins in the GIT, this can lead to diarrhea. Alright, so The next mechanism that can result in diarrheal disease is the inflammatory mechanism. Inflammation or ulcerative processes such as Crohn's disease and ulcerative colitis can cause diarrheal disease in children. Apart from this, malabsorption. Malabsorption can be by the mechanism of osmotic or secretory mechanism or other processes that decrease the transit time, thereby causing malabsorption in the GIT. Any process that does not allow absorption to take place completely can cause diarrheal disease. So these are the 4 mechanisms that diarrheal disease can come about. So parents, you that always want to go and buy antibiotics when your child have diarrheal disease, it is important for you to know that diarrheal disease can not only be caused by infective organisms. There are other mechanisms that can cause diarrheal disease, and it is important that when a child has diarrheal disease, the child should be given not antibiotics but oral rehydrating solution, ORS. That is what is prescribed. That is what WHO recommends. And ORS are not expensive. They are affordable. You can buy it. If a child has mild dehydration, as a parent, the child is passing loose stool or watery stool more than its usual pattern, what you have to do is to give the child ORS. The child is passing this stool and is still suckling, is not weak. You check the anterior fontanelle, that depression in this place in the child. If the child is still an infant, you check that place. It is still normal, it is not deeply depressed. In other words, it is not sunken. Okay, that pulsation is still normal. Okay, it means the child may be having mild, not moderate to severe dehydration. Or you check the eyes and the child doesn't look like sleepy. Okay, if the child is not looking sleepy or drowsy, it means the child may be having mild but not moderate to severe dehydration. Or the child is still suckling, the child may be having mild dehydration but not moderate to severe dehydration. Or you check, you pinch the child, you pinch and see the return of the skin, what is called skin turgor. It returns almost immediately. The child may be having mild dehydration but not moderate to severe dehydration. So that is the time that you can manage the child. You can give the child ORS. I'm not saying stay at home and manage the child. No, that's not what I say. I say, but you can do something while taking the child to the hospital for proper evaluation and treatment. You can give the child ORS. Then the ORS is prepared by mixing it in with water, clean water, bottled water. Okay, so how do you give the ORS? According to the weight of the child. That is what determines the quantity, and also whether the child is vomiting or not vomiting. If the child has mild dehydration, the formula of giving the ORS is give the child 50 ml per kilogram body weight. If the child, for example, is 3 kilograms and the child you are suspecting this child is having mild dehydration by your own estimation before you go to the hospital, so you know the weight of the child is 3 kilograms. So what you do is 3 times 50, that would be 150 mils. That 150 mils should be given with stainless plates and spoon, not with this thing that you give to children to suck. No, not feeding bottle. Stainless plates and stainless spoon is what you use to scoop and give the child to drink. Okay, if the child is not vomiting, there is no restriction how you can give. You can give it and reassess after 4 hours whether the child is still dehydrated. But if the child is vomiting, you are going to give with a teaspoon, small teaspoon. You're going to give small every 5 minutes. You're going to give every 5 minutes, small teaspoon. So that way, the child will not go into severe dehydration, because one of the complications of diarrheal disease is dehydration, and this dehydration would result in cardiovascular collapse, whereby the circulating volume becomes totally bad. The heart will cease and the child will go. We do not want you to lose your precious children. That is why I am giving you this information, because a number of times I have seen parents brought their children at a point where the burial veins have collapsed and we couldn't do anything to salvage the situation. Not very long, a mother brought a child that has been having frequent loose stool. A 2-month-old child has been having frequent stool for 2 weeks intermittently. Though the mother said she took the child to primary health center and all sort of things were prescribed. All sort of things were prescribed. At the time of presentation, it was already too late. We could not do anything. So, back to how you give ORS. If the child is having moderate dehydration, by observing the child, the anterior fontanelle may be sunken, the eyes may be sunken, the oral mucosa may be moist. I mean, not very moist, maybe dry, and the skin turgor may take time to like more than 2 seconds to return. The capillary refill. If you press your index finger with your thumb, you can notice something on your nail bed. If you release it, you see there will be a filling. So when such filling takes time to be filled up, it takes more than 2 seconds to be filled up, the child may be having moderate dehydration. So if a child has moderate dehydration, what needs to be done is to give the child ORS, and that is 100 mils per kg. That is what should be given the child. If the child is not also vomiting, there is no pattern of how you are going to give, but give the child small quantities so that the child will not vomit, and reassess the child after 4 hours. If the child is still dehydrated, still passing loose or watery stool, frequent stooling more than its usual pattern, then you continue to give. But make sure you take the child to the hospital for proper evaluation and investigation, so that whatever might be responsible for diarrheal disease could be handled in time before it is too late. Now, there are causes of this diarrheal disease. Diarrheal disease can be classified as either acute or chronic. The acute phase is when it is less than 2 weeks. Anything 2 weeks and above becomes chronic. The acute phase of diarrheal disease mostly caused by infective organisms. Number 1 on the list are viruses. Chronic use or abuse of antibiotics drugs use can also cause acute diarrheal disease. Although any enteric pathogenic organism may also cause um, acute diarrhea, but the top on the list there are viruses. So that's why when mothers go to patent drugstore and buy antibiotics, they may just be doing the children more harm than good, because it may not be a bacterial agent that is responsible for the diarrheal disease. Like I said, if it is uh, due to the presence of osmotically active substance in the GIT that is causing the diarrhea, and you are going to give the child, buying antibiotics and giving the child without taking off the osmotically active substance, the child will continue to have diarrhea, and the antibiotics will not do any good. Rather, it will going to cause more harm to the child. What if the child is having malabsorption syndrome and you are giving the child antibiotics on your own? It's going to make the situation worse. So it is important that when you are giving the child ORS, you should also seek medical attention. Now, there are ways in which this diarrheal disease can be prevented, especially for those that are caused by infective organisms. Food hygiene is very important. A number of times I have seen mothers giving their children food with feeding bottle. And I always ask, when you were attending antenatal, were you not told that the way to go is to feed the child with stainless plate and spoon, which you can thoroughly wash without any place for the infective organism to hide? Why giving this? Most of them will say, but it is easy to use. It is easy to use. No, it's not all about the ease of using it, but the health implication. Okay, so it is unfortunate that even some of these mothers who have been enlightened, who have been told what to do, they will still be using what they know is not prescribed by the pediatricians. Okay, so food hygiene is very important. When a child is under 6 months, the pediatricians recommend that the child should be exclusively breastfed. No water, no infant formula, nothing more. All that the child needs is breast milk, because the breast milk is readily available, is cheap, and contains all the nutrients. With water, it contains all the nutrients that the child needs. So if the child is exclusively breastfed, the chances of the child having diarrheal disease will be reduced. Let it be from other causes, but not foodborne, not as the result of food preparation. However, when the child is 6 months and above, and you want to introduce maybe infant formula, you want to give the child extra feed like infant formula or family, food hygiene becomes very important. You must ensure that you always wash your hands with clean water and soap before you prepare the child's meal. And once you have fed the child, leftover food should be discarded, or maybe adults can eat it and finish it. Leftover meal should not be given to the child again. Children's system are not as strong as the adult. Okay, their immune system is not that strong, so they don't have to be given anything that might cause infection in their system. So food hygiene, proper hand washing. If somebody is going to use the convenience and come out, they should make sure they use clean water and soap and wash themselves. If they have, wash their hands thoroughly with clean water and soap before handling any child's food. Okay, so one thing I've also discovered is that whenever a child has diarrhea, mothers would go and buy Lucozade. They call it Lucozade Boost. Oh, the child is passing frequent stool. Oh, I want to give this Lucozade Boost to boost the energy. There's nothing like boosting the energy. That thing may be causing more fluid loss to the child. It's not going to boost anything. There is no energy in that thing that you call Lucozade Boost. There is no energy. It's not boosting anything. So stop giving your child what you call Lucozade Boost. What is recommended, however, is ORS. But I've also seen a situation whereby some mothers complain that their children refuse to take ORS. They don't take it. So in that case, what should you do as a parent? If the child is still being breastfed, give the child breast milk and go to the hospital. Let the pediatrician examine the child and give the child intravenous fluid so that the child will not go into severe dehydration, cardiovascular collapse, and death. So go to the hospital. If the child refuses ORS and is becoming more and more dehydrated, go to the hospital. Please go to a place where you can have a qualified medical doctor, a pediatrician that will treat the child. Recently, one mother went to a PHC and the child was prescribed all sorts of antibiotics, but that did not salvage the situation. There are some things that the people at PHC can handle. There are things that are beyond them. So if something has been given to your child and the child is still having frequent watery stool, still passing stool, please do not hesitate. Do not wait until the epidural veins have collapsed before you start going to the hospital, because it might be too late for any doctor to do anything at that time. Please, mothers, this information is for you. Caregivers, this information is for you. Somebody may say, okay, I do not have ORS. I do not have money to buy ORS. Or there are no place for me to buy ORS and this thing has happened. What should I do? Well, in that case, before you go to the hospital, if you have green coconut water, you can give the child. Okay? You can also prepare what is called salt sugar solution. You measure your common table salt, the salt that we use in cooking. You measure it with your teaspoon, 2 of them, and flat it. Just don't heap, just level the salt. Put it in 1 liter of water. 1 liter of water, you can get it by measuring. Use Coke bottle, measure 2. That will give you 1 liter, or one beer bottle. Measure and put in your thoroughly clean container. Then add sugar cubes. Okay, sugar cubes, 7 sugar cubes. Mix it and give the child in small quantities. That will help the child and stop the child from going into dehydration. Those are the home remedies that you can apply when you don't have ORS, or you do not, or your child refuses to take ORS. But if the child refuses to take ORS, refuses to take salt sugar solution, refuses to take green coconut water, please don't waste time taking the child to the hospital, so that the doctors can give the child intravenous fluid. Okay, so by way of recap, today we have talked about what what diarrheal disease is in children, and we said that when a child passes stools more often than he normally does, that may be diarrheal disease. If your child used to pass stool 3 times in a day and now is passing 4 times, 5 times, or the child passes stool once but the volume, the quantity is much, that is diarrheal disease. Sometimes diarrheal disease can also be associated with vomiting. Okay, there could be vomiting, there could be fever, there could be abdominal pains. So when all these things happen, give the child ORS to prevent dehydration, or if the child has mild dehydration, give the child 50 ml per kg of ORS over 4 hours in small quantities. If the child has moderate dehydration, 100 ml per kg, small quantities over 4 hours. After that, we assess the child. But while you are giving that ORS, make sure you are going to the hospital so that the child can be properly assessed and the cause of the diarrheal disease can be investigated. If it is osmotically active substance that is causing it, the doctor will tell you what to do. If it is secretory substances like toxins from microorganisms that is causing diarrhea, the doctor will help you. Or if it is inflammatory bowel disease or malabsorption causes, the doctor will also help you. Do not try to manage your children that have diarrheal disease by yourself. Do not go to a patent medicine seller and start buying drugs, because those drugs may not be necessary, or it may even worsen the condition of your child. And if severe dehydration sets in, the child may have what is called cardiovascular collapse, and you may lose your child. And losing your dear child will be very painful, and it will take you some time to recover and have more children. Please pass this information. Let mothers also hear what they should do when their children have diarrheal disease. Please follow this information and make your comments known. If you have a question to ask, please drop it in the comments box. I'll do my best to reply. Do not fail to follow this page. Click on the follow button that you see there, and also you can ask questions. If there's any topic that you would want me to talk about, you can also drop it in the comment section. Remember, diarrheal disease is one of the killer diseases in children, and every year 1.5 to 2.5 million children have died because of diarrheal disease. Diarrheal disease can be prevented and can be treated and can be prevented, can be treated and can be prevented. So don't allow your child to die because of diarrheal disease. Till I come your way next time, have a very good listening pleasure.